What makes the VA healthcare system unique?
This is Veteran Experience, and I'm Russ. We cover all things VA. So let's cover this topic.
Just imagine a healthcare system built exclusively for you and your care, where every service, from routine checkups to your specialized treatment, is designed for your unique needs in mind. This isn't just a system, it's one that puts you at the very center of every decision, honoring your service and addressing your challenges. David Shokins, with 25 years of experience in managing healthcare organizations, he states, I've come to realize that many of the essential services provided by the VA cannot be found or even replicated in private care. He provides 6 reasons your VA healthcare is better than the civilian care you would receive if the current administration takes down or dismantles our VA system and sends us out to community care. So let's cover the reasons why now. Unique patient demographics. Veterans, a special population in America. So let's start with one of the most important aspects, the patient population itself. Veterans are inherently different from the general population they come from, a unique set of challenges. And that's why the VA is built differently. This means that every element of your care in this system is specialized. Screening to long-term planning is tailored to meet the distinctive healthcare needs that you may have and those have served this country. Comprehensive integrated care as a one-stop shop. This is what the VA offers. One of the standout benefits of the VA healthcare system is its comprehensive and integrated approach to your care. Imagine walking into one facility and finding everything you need, from primary care to specialized service like mental health, rehabilitation, and even social services. This integration is something that the private sector struggles with and cannot replicate. In the VA, all of these services are interconnected, following a seamless transition between different levels of care. This one-stop shop model isn't about just convenience. It's about creating a continuum of care that is both efficient and effective. When care is integrated, leading to better outcomes, improved patient satisfaction, and reduction in costs. Think about it. When a patient physically, psychologically, and even economically needs are addressed in a unified system, the treatment plans become holistic. This means that the VA is not treating the illness, but also considers the broader aspect of the veteran's well-being, including support for housing, transportation, and caregiver needs. The treatment-based approach, patient-aligned care teams. Let's talk about one of the cornerstones of VA care, the team-based model known as patient-aligned care. This is cutting edge. This approach revolutionizes how primary care is delivered. In the PACT model, every veteran is supported by a diverse team that might include primary care providers, nurses, managers, social workers, pharmacists, nutritionists, behavioral health professionals, and much more. What? The veteran and their families are all integrated into this team. This model is all about being proactive, personalized. It's not just about managing disease. It's about preventing it. By engaging patients in their own care, the VA fosters an environment of continuous support and communication. Studies have shown that such team-based approaches leads to fewer hospitalizations and emergency room visits, along with better overall outcome for the patient. Imagine having a delicate group of professionals who not only treat your symptoms, but who help you manage your health long term. Specialized and expertise is also added into this mix. One of the key strengths of the VA healthcare system is its specialized expertise. Veterans often face conditions that are rare and less common in the civilian population, conditions that are directly connected to their military service, from spinal cord injuries to traumatic brain injuries, from limb loss, chronic pain. The VA specialists who have dedicated their careers to understanding these conditions and treating these issues. And it's not just physical health. Mental health is a huge focus here at the VA. The VA has been a leader in developing programs for PTSD, depression, anxiety, substance abuse, and we all know suicide prevention. These clinics are not only trained to recognize the conditions, but they also care and they treat you as a human being. This is critical, given that many private sector providers might not have the depth of knowledge or the experience needed to tackle these complex service-connected injuries. Consider this: while less than 50% of private practice primary care providers routinely screen for PTSD, depression, or anxiety, the VA has integrated the scanning in their approach to deliver holistic medical care for the veteran. And this kind of focused experience can mean the difference between early intervention and a crisis situation. A holistic approach, the approach that is beyond the physical, is what is needed and VA offers. Healthcare isn't just about treating a disease or symptoms. It's about caring for the whole person. And this is where the VA really shines with its holistic approach to care. Veteran families, counseling sessions, and community support programs are highlights of this. The VA looks beyond the immediate physical and mental symptoms to consider all the factors that affect the veteran's health. This means taking into account social, economic, and even familial factors. Many veterans struggle with issues like homelessness, transportation, and limited access to community support. The VA steps in, offering not only medical care, but also assistance with housing, transportation, and even caregiver support. If these vital programs are cut in 2025, it will leave many veterans devastated and severely impacted on their ability to live a normal life. By addressing the broader determinants of health, the VA ensures that veterans receive the support they rightly deserve. And managing long-term wellness are key. When a healthcare provider takes the time to consider the full context of the patient's life and health, the results speaks for themselves. Better adherence to treatment, improved outcomes, and a higher overall quality of life for you, the veteran. The VA is investing in innovative ways and to scale the medical treatment that is offered to the veteran. Another remarkable benefit of the VA healthcare system is its significant investment in innovation and technology. As the largest integrated healthcare system in the United States, the VA has built capacities that many smaller systems just only can dream of. Think about it. The VA has an electronic medical records platform that has been capturing veterans' health data system-wide for more than 2 decades. This is a treasure trove of information, allowing sophisticated big data analysts and cutting-edge research. And with initiatives like the Million Veteran Program, which is building a gene, this leads to deeper relationships and ultimately better care. When you combine this continuity with the specialized expertise and holistic care that the VA model offers, we've talked about, it becomes clear that the VA isn't just an alternative to private care. It is a system that far exceeds private care. It optimized to meet the needs of the veteran. To put all of this into perspective, let's look in the real world impact across the country. Countless veterans have experienced firsthand the benefits of VA healthcare. From improved management to chronic conditions to enhanced mental health support, the outcomes speak for themselves. Many studies have shown that the VA performs as well and in many cases far better than private healthcare. There are several key indicators, including blood pressure control, diabetes management. Consider the story of the veteran who, after years of struggling with both physical injuries and mental health challenges, found a renewed sense of hope and health through the VA system. With coordinated care that addresses everything from medication management to counseling and social support, this veteran experienced a dramatic turnaround in their ability to live life. These stories are everywhere in the VA system, and they are a testament to the VA's dedication, integrated approach. The future of the VA healthcare system, a model for the nation. As you look to the future, the VA healthcare system is a model that the U.S. private medical healthcare facility should emulate, not discard. The VA healthcare system is driving phenomenal results in patient care and efficiencies and cost saving. As we look to the future, the VA healthcare system is not standing still. With ongoing investment in research, technology, and innovative care models, the VA is poised not only to continue serving veterans, but to lead in healthcare in the United States, transforming the way healthcare is given to complex medical injuries. Imagine a healthcare system that uses real-time data to predict health issues before they become crises, that leverages research to tailor treatments specifically to you, that continually learns and adapts to deliver the best care possible. That's the vision for the future of VA healthcare. My experience with over a decade using VA healthcare exclusively, I've found that from my experience, they are above the par with the healthcare that is given. Private healthcare, if you find a good doctor, great. But in general, the complexity of the injuries we received on active duty, they are out of the scope of most private care physicians. And then the continuity of care and the integrated parts of the care, from physical to mental to daily life resources, cannot be provided by the private care provider. So I say, as one veteran to another, I encourage you to use your healthcare system. You won't be disappointed. If you found this information to be valuable, please like, subscribe, send it out to other veterans that you know that are not in the VA healthcare system. Let's get them in the healthcare system, that if their injuries start to arise, there's appropriate care for them. Thank you for watching the video all the way to the end, and do what we always say do on this channel: keep fighting for what you deserve.